Thanks to all of you for being here. Good evening, and thanks for your patience. I'm Steve Bender. I'm Executive Director of the 1199 Training Fund, and we so appreciate all of you being here. Thanks to the media for being here, to our union leaders and members, family and friends of writers, and most of all to the union members / writers who are now published authors. Congratulations. This is such a big deal for all of you. Nursing home and home care workers have always worked under extremely difficult conditions. We know that they care for the most vulnerable members of our community, working long hours for low wages, without a lot of appreciation or understanding from the public. And then last spring, COVID hit. It came down on us all like an avalanche, and suddenly these workers were essential workers. And all of us who knew these workers were pleased at this long overdue recognition, but we wanted the world to really see their faces, to hear their voices, which is why the 1199 Training Fund launched this writing project. Our teachers, who are wonderful, help the workers draw on their experiences to craft honest, heartfelt accounts of their work and their life. Many had never written stories before. Some of you were afraid to begin, weren't sure what to do. But once our teachers made it clear that your stories were important, that your feelings and insights are valuable, that you're valuable, well, I know because I saw some of it. The words were pouring out, the stories took wing, and the book was easily birthed. So congratulations to all of you. Thanks again to everybody who's here tonight. We have a short program for you. And before we start that, we would just like to do a short moment of silence to celebrate the long-term care workers everywhere and the sacrifices they have made and continue to make. So let's do a short moment of silence, please, then we'll start our program. Okay, thank you very much, all of you. The first on our program I'd like to introduce is Kambar Edwards. Kambar is a CNA with over 24 years of experience, works at Kimberly Hall South, a nursing home in Windsor, has been a longtime union delegate and leader of the union as well, and a writer. She has participated in writing projects. She's not a published author for the first time. This is not new for Kambar, but she has 2 stories in this publication, and Kambar would like to read just a short paragraph from one of her pieces. So Kambar.
Thank you, Steve. Over the days that I was out on vacation, I was extremely emotional, as I have never experienced anything like this dangerous health epidemic before. I didn't know what the outcome would be for my fellow co-workers. I was also suspicious about my own prior interaction on the job as well. I had no idea if I could calm down. I was also suspicious of my own prior interaction on the job as well. I had no idea if I too could come down with the coronavirus. My worry and my fear for my co-workers, the nursing home resident, me and my family was overwhelming. By this time, our governor made self-quarantine mandatory for the healthcare workers and all essential workers who were exposed to the virus. I received outgoing calls from workers who were frantic about residents dying. Workers were becoming fearful by the hour due to the unknown coronavirus behavior. Thank you. I just want to say thanks to the 1199 Training Fund that have provided this great opportunity for us not to just tell the story by to our organizer or the president of 1199, but give us the opportunity to write a book pertaining to all that took place behind closed doors. Thank you.
Okay. Next, I would like to introduce Suzanne Clark. Suzanne is the Secretary Treasurer of District 1199 New England.
Thank you, Steve, and thank you, Kambar, and other authors. Just on behalf of the officers, the executive board, and over 26,000 members of 1199, and on behalf of our president, Rob Burrill, who's unable to be here tonight, we are always proud and amazed at the work our 1199 caregivers do. But tonight we could not be more proud to see them really just on such a personal level, bearing their soul, bearing their artistry, and standing before you as authors. And so I congratulate all of them and the contributions that they are giving and sharing with us here today. As many of you know, 1199 is rooted in the civil rights movement. Back in the day, hospital workers actually weren't considered workers. It was women's work. Healthcare workers were systematically excluded from the Fair Labor Standards Act, as were many other predominantly Black and brown workers, especially women. And it wasn't until hospital workers rose up and rallied and struck again and again that the law was changed to recognize them as workers. Today, none of us really think about that hospital workers could be so disregarded and undervalued. We've come a long way, and yet long-term care workers are very much still shackled with the chains of that history. Most of the people you see here are long-term caregivers, but for those listening who aren't, I just want to help create a little bit of a context. Imagine being surrounded at work by people who are crying out for your love and attention every day. They're aging, they may be confused, they may not have control over their bodily functions, and yet are desperately trying to maintain their independence and their dignity. These caregivers hold their hands and comfort them when often their own family don't call or visit. They're the ones who are there when they're scared, when they're angry, when they're lonely or depressed. But yet there's not enough funding for the hours or the staff that are needed to provide the quality care that these residents deserve, for them to spend the time with them that they deserve. There's barely enough time to provide them with the assistance of their most basic needs. Now imagine you are that caregiver, racing from room to room, from your first job to your second job, trying to raise a family, trying to be everything to everyone, so that your children can get a new pair of shoes, so that you can have presents for Christmas, food on the table, or just frankly to keep the electricity on. Now do it in a pandemic. Do it for $15, maybe $16 an hour. Do it wearing a 4-day-old N95 mask, or more likely wearing a non-medical grade or medical grade surgical mask. While you're struggling to contain a virus, you're also struggling to pay for health insurance. And every breath you take could mean the spreading or the contracting of that deadly virus to yourself, to those you're caring for, or to your family. They hang banners calling these women heroes, and yet behind closed doors, they're treated like they're expendable. Some of these stories may disturb you and may shock the general public, and frankly, they should. I hear a lot of people talking about going back to normal, but every home care personal attendant, every group home worker, every nursing home worker will tell you that in the long-term care industry, going back to normal is not acceptable. And so we're here to urge you to listen and take to heart what you hear tonight. And then next week, we urge you to join us on Tuesday, December 22nd at 4 p.m. at the state capitol as we raise the voices of long-term care workers to demand that the state fund long-term care in order to make these critical structural changes needed so that caregivers and those they care for can live in dignity. Thank you.
Thank you, Suzanne, very much for those words. We'd like to continue with our program now. And we're going to show a video of Mary Beth Simoneau. Mary Beth is also a CNA, is from Wallingford. works at Arden House, a nursing home in Hamden. Mary Beth told me recently she has worked there for 38 years. Wouldn't know that looking for it. I think she started there when she was about 8 years old, but Mary Beth is a wonderful writer as well and recorded her story. It's about 4 minutes long, so we'd like to play that for you tonight. So give me just a second and I will get that video up for you.
My name is Mary Beth. I'm a certified nursing assistant and a union delegate on the exec board. The COVID-19 virus was just hitting nursing homes in Connecticut when I went out with knee surgery on March 13th. I haven't been to the facility to work since my surgery. I've been keeping busy while out on leave, helping my friends and coworkers, and sometimes it's the smallest things, but it makes them smile. Today, I am bringing supplies to Francine. We have been friends for years now as CNAs and union organizers. Francine had been working on a unit that had been ravaged with COVID-19. The death count was too high for the residents living there. One day, Francine went to her mother's, and while there, she fell. As she lay on the floor, her mother cradled her head in her lap, waiting patiently for the ambulance to arrive. When Francine was admitted to the hospital, they tested her for COVID-19 and found that she too had acquired the virus. She was one of the first CNAs in Connecticut to acquire the virus from working in an extended care facility. My heart goes out to her and the battle she's fighting even today. Unfortunately, her struggle will continue for the unforeseen future. The virus does its damage, not just to the individual that has it, but to everyone who comes in contact with her, her family, her friends, and her coworkers. Francine hasn't gotten a paycheck in a few weeks, and I knew she was running low on supplies. I texted her as much as I could off and on, but not too much to be of a nuisance. I asked her what she needed. You name it, anything, and I'll bring it to you. She didn't reply, which wasn't unusual because of her condition. The next morning, I just decided and I went shopping for Francine and her kids. I knew she needed fluids and paper supplies for eating. I didn't want her to use the plates and silverware that would need to be washed while having the virus. I wanted to make sure that she got what she needed and her kids had things that were easy to open and could go right in the microwave if needed. I knew my colleague didn't have the energy to cook for her children, so the care package contained ready-to-heat items like Chef Boyardee and soups. There was Gatorade too for Francine's electrolytes. The kids, I thought, needed a treat, so Lunchables and apple juice and chips. There was also some fresh fruits like strawberries. When I was finished shopping and filling the box, I headed to her home in Hartford. About halfway there, she texted me, "All I want is blueberries. I'm okay with everything else." So I found a store, got her a giant container of blueberries, and then off I went to her home again. About a week later, her mother was diagnosed with the virus. Mom had been practicing safe quarantining as recommended by the state. Francine was at home when her mother was admitted and unable to visit her at any point of her hospital stay. I visited Francine's house one more time after that, dropping off food items. She texted me that her mom had passed, and the family was trying to figure out how to pay for this. They started a GoFundMe page. Francine never got to see her mother again. Her last memory would be that of her mother cradling Francine's head while waiting for the ambulance for her. When the funeral preparations were finalized, she texted me an invitation to the service, and I felt honored that she included me. The service was beautiful. The family wore white and red accents, red rosebud, red sash, red shoes, but mostly red face masks that someone had made for the family. They had calling hours and funeral services immediately following. I viewed the mother in the casket. She was a pretty woman. I spoke for a few moments with Francine, who introduced me to her family. As the service was about to begin, I eased my way out the door. After all, this was to be a private celebration. Her mother's prayer card is on my desk, an everyday reminder of how many loved ones we have lost.
Mary Beth, thank you so much for sharing that, for writing that, for being willing to have us all listen to that tonight. If you just have a few words you would like to share now.
I'm still very emotional about it. I wish everyone would take advantage of this program because it's very therapeutic. And most people in nursing homes have PTSD now, and they're very scared. I'm sorry. Today they're like, oh, this one have COVID? Oh no, this one's got COVID. And we patiently wait when they go to the hospital to find out what they have. Last one had pulmonary embolism, but even the fire department said it looks like COVID to us. I don't know if we'll ever recover.
Mary Beth, thank you so much.
Yep.
Thanks for being here and thanks for sharing all of that. Next, we have another short video. This is by Pamela Hunt. Hopefully, I'm sorry, the last one, I guess I didn't have the video up right away. Hopefully I'll figure this out. Pamela Hunt is a personal care attendant, a PCA. And so I'm going to start hers right now.
I contracted COVID-19 on September 21st, 2020, as did 8 other family members. We gathered for an impromptu birthday celebration for the remaining matriarch of the family, my mother, who turned 81 years of age. As joyous as the celebration was, we definitely got more than we anticipated or bargained for. I struggled for 23 days with COVID-19 while having to take care of Joshua. I received PPE the very next day after notifying DDS that I had tested positive. The next day, I awoke to 5 bags of PPE. It felt like Christmas. My greatest fear was to infect my son with something that seemed to be more deadly and vicious than any abnormalities he currently has. The Bible says, in all things, give thanks. I found myself saying thank you because Joshua was admitted to the hospital 4 days later with a bladder infection. And that meant for the next 10 days, he was safe from me. I was also saying thank you that my PPE distribution was entirely different than my sister's. Her and my mother were a part of the 8 who contracted the coronavirus. My sister contacted DSS, and it was a full 3 days before she received any PPE. To me, it felt like Christmas. For her, she must have felt like the kid with the proverbial lump of coal in her stocking. 3 days could have been a death sentence for Joshua. So as I gave thanks then, I give it today. Because I'm over COVID, Josh didn't get it. Everyone else has recovered. But mostly, I give thanks that my son is a DDS client and not a DSS client, as is the matriarch.
Okay. Thank you, Pam Hunt. And Pam, if you'd like to just very briefly say a word or two about your experience as well.
Hi, everybody. Well, I wasn't even going to write the story because I just wasn't going to write the story. I was like, oh, that's not something I need to do. But I'm glad I did it. I never expected to be in a book or described as an author. But once I started thinking about, what happened, me getting COVID, my family getting COVID, it was a story that needed to be told because it's real. I mean, we watch what we see on TV and we think it's somewhere way out there and it's not going to affect us, but it's real. It's here. It's in our backyard. And, it's a story that needs to be told because as home care workers and going in and out of everybody's homes and taking care of different people, we do a very at times, I guess you could say, dangerous job. And we need to be protected. We need to be acknowledged as doing something very important. So these stories are good because it's going to allow people to know exactly who we are, what we do, and how important it is, and that we deserve to be safe from harm. And I'm glad I got the opportunity. Thank you, Steve. Thank you, Tim. Thank you, 1199.
What Pam read tonight was actually an addendum, just a short piece that she added to update her family's circumstances. She has a much longer and beautiful story that's in the book. So that those of you who have that, please take a look and read her whole story. We have one more of our authors now, Claire Martin, who is another personal care attendant, a PCA, home care worker. And Claire would like to read also just a short piece of her story as well. Claire?
Okay. Hi, everybody. My piece from The Gift of Care. The unique thing about the coronavirus is the way it exposes every vulnerability. It doesn't stay in one lane. Whatever can be exploited is. The American economy is crumbling. People without safety nets or high wages face financial ruin and homelessness. And those with imperfect health face those conditions being exacerbated or death. It's important to keep up with all the latest research and take all the necessary precautions. It's important to take coronavirus very seriously and to minimize the risk of infection. But it's also important to remember good days. And for some, the difference between a good day and a bad day is who you spend it with. And I need to stay alive because I want to give Ellie as many good days as I can. Thank you.
Thank you, Claire, for sharing that. I know, and Claire also, this was just a short piece of a much longer story. Ellie is not the real name of the person she gives care to, but wrote a beautiful story. Claire, if there's another word or two you'd like to share about this experience.
Yeah, actually, this has been just an amazing experience because I have always loved writing, and that is how I process things. And then there was this opportunity, and I felt like I could write about this experience that had just happened. It was very fresh. But I felt like I needed to write it to get the message out there. I feel like coronavirus, we worry so much about the physical aspects, but there are also mental health issues. I lost a friend to suicide this past year during quarantine. So it's something that I want to bring to the attention of the world, really. And also just to see my name, Claire Martin, author, it just gives me a little thrill because that's what I always wanted to be ever since I was a kid. I want to be a writer. And now I feel like that dream has actually come true. So thank you, 1199. Thank you, Steve Bender. Thank you, Tim. Tim Sheard. This was amazing. Thank you so much.
Claire, thank you. And you know what? It's the 1199 Training Fund. We love hearing that the fund helps people's dreams come true, and that's so lovely, and thank you. And I just want to introduce now Tim Sheard, who a number of the authors have mentioned. Tim is a good friend. Tim is the publisher of a company named Hardball Press based in New York, who we have worked with for many years. Tim has published has both taught workshops and worked and mentored union members and other working class writers for very many years, and worked with our members on this book. And Tim, if you would just like to talk for a brief minute or two as well about your experience and what all this means for you. Thanks.
Thank you, Steve. Well, to my dear, dear friends up in New England, 1199. First, you can hear me? Yes?
You're very soft, Tim.
Oh boy, let me turn my volume up. Is this any better?
A little bit better. I
No?
think folks can hear. Might be the
How
headphones.
about now? Is it better now? Now?
Yeah, a little better.
Okay, so to my dear friends in 1199, I'm so grateful that you trusted your stories with me, which is to say you trusted your lives with me. It was a little bit like I was the caregiver and you were going to let me take care of your stories. And I just can't thank you enough. It's an honor to work with you. And it was just an exhilarating experience. The other thing I want to say is working with writers like you, working class writers, is a lot of fun. It's work. There can be difficult moments. There can be some disagreements and so on. But it's a thrill to see these stories coming together, to see you starting on them and then stopping and then working on them and then discovering what you can do. So for me as an editor, it was just a thrill. It was just, I had so much fun with this project. I would do it again in a heartbeat. And I hope we get to work together again one time soon.
Thank you. Thank you, Tim. As always, we have a long relationship with Tim and with Hardball Press, and really appreciate you being here as well and all the work you've done with us over the years. That's all we have as a prepared program. We would, for any reporters that are here, if we would like to open this up to any questions that any of you might have for any of the folks that have spoken tonight.
I'd like to ask Suzanne Clark a question.
Sure.
This is Susan Dunn from The Current, by the way. Suzanne, you mentioned something happening on December 22nd at the state capitol. Could you give me a little more detail about that?
Yeah, we're holding a rally and vigil to really call for the kind of funding that the long-term care industry needs to be able to provide the dignity, the care conditions, the protection that long-term care workers need. We've heard some, really shocking examples, but we also know that the problems in the long-term care industry did not start with the pandemic. They existed before, and it's only further dramatized by the just horrific conditions in the pandemic. But these are all underlying problems that until we really address that underlying systemic problem, deeply rooted in structural racism ultimately in our society, but that the kind of problems will continue to go on unless we really look at the root of it. So we'll be rallying on December 22nd at 4 p.m. at the Capitol.
Okay, thank you. I also have a question for Kambar Edwards. Steve mentioned that the name Ellie that Claire was using to describe her friend was not Ellie's real name. I was reading your item. I read the book this afternoon, and I was reading your item about your friend who did not receive the letter, and you suspected that it might have been because she was the vocal one. She was the one who told people when things were becoming awry. Is the name you use in the book that person's actual name?
Me? Yeah, she asked you that question. Is this question for me?
Yes, it's for you, Kambar.
Oh, no, it's
not
not the
receive the
person's
letter.
right name.
I'm sorry, say that again.
It's not the person's right name.
Okay, all right. I just wanted to make sure. When I use a quote from that piece, I want to make sure of that so I can gloss over it and say not the accurate name, because I thought we might get that person in trouble. And that's it. Thank you.
Okay.
Any other questions from reporters that are here?
Hey, Steve, this is Nicole at WNPR.
Sure, hi.
I had a question for a couple of the speakers who, when any one of you, or I think it was Mary Beth who had talked about how cathartic this process could be. I was wondering if any of you could speak a little bit more to that and, what was this process like? Was this an opportunity for anybody to maybe perhaps come to terms with some of their experiences or emotions that they had not really processed yet until they sat down in the workshops, or to really put their thoughts into words?
Okay. Well, Mary Beth, do you want to start? And if any of the other authors have comments on that, please do.
Mary Beth, you need to unmute.
So many of us have PTSD from what we've seen and gone through because we've never gone through it before. Sitting down and writing out what you saw, what you felt, just the beginning of something that needs to be done for healthcare workers. Now with it hitting nursing homes again, I don't know what we can do for them. People are scared. People aren't coming back to their jobs. They need help.
Okay, thank you. Are there any of the other writers, either home care workers or nursing home workers, that would like to comment on Nicole's question about if writing your story helped you come to terms with some of the things you've experienced?
Me, I just wanted to say a word that, like I was saying earlier, my experience was really fresh. And so I agreed to participate in the workshop. And then I kind of, well, Tim can tell you, I kind of like waited to write my story because it was hard to write. And I knew that I had to write it in a certain way. And I had to come to terms with all those feelings. So it actually did help a lot to write it down. And now I feel like I've taken that part of my life and put it somewhere and I can move on. So definitely, I think writing just in general is very therapeutic, and this project and having it published and my voice out there was incredibly validating. And it was, yeah, I think it was just a great thing for all caregivers to get our voice out.
Hi, this is Tanya Beckford. I just wanted to tag on to the young lady that just spoke. After 7 months, I just returned back to work, and this process for me, writing the first half of it, because I didn't finish writing because I found myself going into a Great Depression, and for me, as a Jamaican, it's not something that we really like to discuss any kind of weakness to show to the public, because we don't like to show that side of us. And for me to have to go and speak to a counselor for a couple of months to try and get the feelings out, because I became so emotional. I cried about every single thing. I developed pneumonia. I'm still getting treatments for my lungs, because my lungs got a little bit, got hurt a little bit. So I'm still on treatment and my breathing treatment now, but I am back to work and was just told today that there's another, oh boy, COVID patient coming into the building. So I'm a little bit on edge, but I try not to get into that fearful mode again, because, I have a better understanding of what it's all about this time and what to look out for and the precaution to take now. But, we're still not really prepared. We're not prepared. And, I'm just praying to God that this time around, that it will be a little bit different than it was the first time. But it was a hard process for me, very hard. Going through depression for me, it's, because my kids consider me to be Wonder Woman. So for me to have to feel some kind of weakness like this, it was really hard. But I was glad that I got the opportunity to write the book. The second half of it, I couldn't finish because I just couldn't finish at that time. But I do thank Steve Tim, 1199, for getting me to talk about it a little bit, because it was helpful, and hopefully I could continue to write, because I am doing that now, writing everything down now, and hopefully could publish that later on. But right now it's just like a private thing for me, and that's what it is now. Let's see what happened from this point on.
Beautiful. Thank you. Thank you, Tanya. I would just,
Hi.
yeah, Betsy, you wanted to give a comment?
Yes, I did want to give a comment. I'm just thankful for being able to write about the story, because in the beginning, you know, when the world just shut down, and I still had to go to work, to 2 jobs, go home to my family. It was very stressful with no PPE. And going through this and everything, and with the grace of God, that just going through a word that I'm going to bring it to my family, going to bring it to one of the clients and everything. It was very, very scary. And it's just like everything was being planted in your head that you got to be careful for this, and with my age and everything, and still had to go because I couldn't fail my clients. I had to be there for them. So now it is a little easier, writing out, what you felt and everything, and and not being able to visit your family, and seeing your grandkids, and and stuff, and have to go through all of this and everything. So it is a little easier, I just trust in God, and just I'm just thankful that I was able to write that and kind of feel a little more ease now.
Betsy, thank you. Thank you for sharing that. I know. Char, who is a nurse at Chelsea Place in Hartford, who wrote a lovely story where she partly talked about her dog and the importance of that. Char, do you have a quick thought you'd like to make?
Yes. Hello, everyone. Thank you, Steve, Kim, and Diane. Actually, I was so surprised when I saw my name in the book and my article. Actually, I didn't do much, but I'm so thankful to all of you. You give me so much encouragement. So this was my first time writing something like that. And Kim is definitely my teacher and guide. He's a very nice person. So I don't know for how long I'm going to work. I'm already 64. So in future, if I get the chance again, I will be a little better story writer. And thank you again, 1199. Thank you, my old friends. And another thing, actually, I have different nature. If I have some problem, I will be still smiling. That's the way I am. So I had 2 nursing home actually, one at Chelsea Place, one at my home, because my husband is Parkinson's patient. So when I go home, I have to take care of him. So he expects I cannot say no after going home, change, all clothes and take shower. So it was kind of difficult, but I'm kind of person, I really leave everything in God's hand. Whatever you want to do, you can do. It's my job to do my part. You have to do your part. That's the way I am. And that's what I have my prayer room in my house, and I'm too much stressed. I go there and sit and meditate. That's it. So again, I will say thank you very much, Steve. I attend all nurses conferences. I always enjoy, but this year I missed that.
Yeah. Well, thank you so much. Glad you could be part of this.
Okay. Thank you very much. Thank you very much.
Yeah. And Char is at work, if you could probably tell, but glad that she works the second shift at Chelsea Place. So really glad you could find a few minutes to join us tonight. Well, we're running, it's 10 of 6. I don't want to cut things off, but if there are any other reporters that have another question or two, we could probably finish up with that.
Hey, Steve, I just have one more question, and this might be for you, but what is the main goal as far as who you guys want to read, for them to read this book? Is it, you know, people in everyday life that may not understand understand the experiences that all of you are going through? Is it legislators? Is it state leaders who can sort of instigate some changes? I mean, who's your audience that you hope will read these stories?
Well, I think I'll just give a very short answer. I think all of the above. It's extremely important that individual people out there have a better understanding of what these frontline workers are dealing with and going through on a day-to-day basis. It's absolutely also important that policymakers, politicians, other community leaders read these stories and have a deeper understanding of the day-to-day lives and the challenges and the courage that these workers are showing on such a regular basis, in the hopes that they will get the respect and dignity and financial resources that are so deserved. So all of the above, from the person on the street to policymakers and in between, I think is our hope for something like this.
Thank you.
You're welcome. Okay, any other, are there any other, we should finish up because it's running late, but are there any other authors that would like to, who haven't spoken yet, who would like to make a quick comment before we, before the news media departs? And if not, that's fine, but yeah, Sho, would, I see you raising your hand. Shomit is a personal care attendant as well.
Yeah, just adding to what Steve said, the audience is everyone, including ourselves. I came from the outside. I wasn't a home care worker. I came from a corporate world, and so I didn't even know that home care work was a thing. I never even thought about it. I mean, I in hindsight, I realized it was obvious, but I never actually thought about it. So if you don't even realize that home care profession exists, then how would you know what home care workers go through? And this book has come out at a very opportune time, given that home care workers are at the intersection of the two biggest crises of 2020, pandemic being one and the other being systemic racism. So I hope this sheds light. This brings our profession to the forefront.
Thank you very much, Sho. Very well said. Thank you. I would just like to mention also, I've mentioned before Hardball Press, which is Tim's publishing company. And Tim published a beautiful small book called A Pandemic Nurse's Diary, which featured interviews he did over a series of months in the early days of the pandemic. And he published that as a collection recently on Hardball Press. And for those of you that are looking for another version of a nurse working during COVID, it's an absolutely fabulous piece. So please, hardballpress.com, you can find that and lots of other things as well. Well, I think if there's no other questions from reporters, if there are, that's fine. But if not, we would like to thank you all, especially the news media, for being here. And for those from the union, the authors and staff and others, we're inviting you to stay on after the reporters leave for a short after party so we can celebrate with each other. So don't leave. Are there any other quick questions from reporters before you take off? Well, thank you so much. It means a lot that you're interested and find value in this. And thank you very, very much. And you know how to get a hold of us, or certainly I know you're in touch with Pedro at 1199 if you need more follow-up. Thank you so much.